Does health mean the absence of disease? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Welcome and thank you so much for joining us. If you are a first-time listener, we're so excited and happy that you've joined us on this journey. And please go back and check out our library of podcasts. We have over 300 podcasts.
We're almost to 350.
There you go. 350, almost.
Yeah.
Okay. And we've got, yes, we've been doing this for a while. And I know that we have a lot of loyal followers that have been on this journey with us for a while. And I just want you to know that we appreciate you and we are ever so grateful that you continue to take the time to include us in your week.
All right. I was going to tell you, we had some viewers on, I don't know if they were just listeners or if they were viewers on YouTube, but they mentioned that they wanted more podcasts. Not just one a week, because we typically do one a week. So, but you know, Dr. Cruz is scoping butts most of the time, so it's hard for us to do more than one a week.
It is pretty busy, but don't be fooled. It's not just me. It's also my beloved wife and partner here, business partner, who is crazy busy. So it's both of us. But you know what? We'll see what we can do. We'll see what we can do.
We're doing our best right now.
We are.
Bringing you love at least once a week.
That's right. That's right. We actually do love doing this a lot. I mean, honestly, sometimes we don't know what we're going to talk about, you know, but it's okay because we find something and we just go with it. And so, you know, is health the absence of disease? You know, that's a great question. And honestly, I don't think it's like a straightforward answer because, first of all, I think the answer that I'm going to say is not necessarily. Okay? I mean, just because you feel healthy and look healthy doesn't mean that there is not something going on. I mean, a really great example is doing a colonoscopy, okay? That's actually the best example because I've had many patients who have asked me, well, why do I need a colonoscopy? I mean, I know I'm, 50 years old. Well, now the age is 45. I'm 45 years old, but I feel great. I don't have any symptoms, no bleeding, my bowel movements are great. Why do I need a colonoscopy? Well, a screening colonoscopy is for preventive purposes, okay? And so I typically will tell them, look, you could be feeling great and still have something growing in your colon. And it's pretty amazing. I mean, I will do colonoscopies. I do hundreds and hundreds of colonoscopies on patients that are coming in just for a screening preventive colonoscopy who feel wonderful, have no symptoms, and I find polyps. In fact, I have also found cancer, okay? It's not the typical finding on someone who has no symptoms and is coming in just for a screening colonoscopy, but I have absolutely found cancer on a screening colonoscopy.
It's amazing.
It is.
Yeah.
It really is. I mean, it's really humbling, right? So I'm a huge believer in preventive and actually preventive medicine. When I was younger, I was a kid.
I was gonna say, you're still so young.
I know. Why did I say that? Actually, when I was younger and I was a child and I knew that I wanted to be a doctor, I remember for a long time wanting to be a preventive medicine doctor. And, there actually is a preventive medicine fellowship that you can do, as far as I recall. But I mean, what I wanted to do was help people prevent disease, okay? And I think just what happened is you get into med school, you get really busy, then you start doing your rotations, you start rotating through different specialties, and you get enamored with a specialty, and before you know it, you're my preventive medicine thing
was preventive medicine one of the specialties you rotated
If I'm not mistaken, there is actually a fellowship or a residency for preventive medicine, but it turns out that it's more of like public health type of thing where you're doing a lot of studies and that sort of thing.
So really not like getting in deep with people, helping them prevent.
Not in the same way. I could be wrong. I could be absolutely wrong because I never actually even further researched it once I got into med school, because then I got enamored with family medicine and then ultimately internal medicine and then ultimately gastroenterology. So I never even looked back to look into preventive medicine. However, when we started on this journey, our goal was to try to help patients that we were doing these workups on that were coming back still having symptoms. Like I do colonoscopy, upper endoscopy, CAT scans, blood work, everything is negative, benign, nothing bad. And they're still coming in with issues, and that's when Tina and I started our journey and started really learning a lot about what I consider to be a major missing link in our training in medical school, and even as a gastroenterologist, and that's on nutrition. We started reading all sorts of, hundreds of books and all sorts of stuff in regards to nutrition, wellness, and that's how we started on this journey.
Even on the concept of digestion, right? Like you not learning as a GI doctor that every decade your enzyme production declines.
Right.
Like that would have been really helpful.
Yeah, we learned that.
GI training.
We learned that together on our journey.
Exactly.
We learned that together on our journey. So it was, so the whole aspect of preventing is really a huge thing. Okay, so let's go back to preventive tests. Colonoscopy. A screening colonoscopy is a preventive test. For women, a mammogram. Okay, we get mammograms done. That's pap smears. Men get their PSA checked, which is the prostate, the blood test. Okay, or they get a rectal exam to feel their prostate. I mean, these are all screening preventive tests that we start doing at a certain age. There's guidelines for all of those, and we start doing them. And it's because we're trying to prevent. We're trying to prevent by doing a colonoscopy. If I find polyps, I take those polyps off. If those polyps turn out to be precancerous, which is still benign, precancerous polyps are the kind of polyps that if you left them there, over time would eventually grow and turn into a tumor, into a cancer. So when I take those polyps off, I've now eliminated something that could have turned into something worse. Okay, so I've just prevented this person from getting colon cancer. All right. And, the same thing with a mammogram. You go and get a mammogram. I mean, they're looking for something. And if they find something, the hope is that it's small enough that it's been caught at an early stage. All right. So so you may be feeling great, and feel, have no symptoms and your skin may be glowing, and that's awesome. And that's great. So whatever you're doing, it's awesome, but you want to still be doing things to prevent, okay, things to be proactive, because the reality is that we're all getting older. We are all aging. From the moment you're born, you start aging, okay? We are all aging. We're getting older, and our body eventually our body, starts to tire out and doesn't filter out abnormal cells like it might have 20 years ago, 20 years from whatever age I'm at now, because, I am young. So anyways, but I was asking Tina, so we were just kind of bantering back and forth on this topic today. And I asked her, I said, okay, so hundreds and hundreds of patients that we do as a gastroenterologist, we do these full workups. They come in with, whatever.
Thousands and thousands.
Yeah, thousands. They come in with all sorts of symptoms.
You were just asking me how many patients we touch in a month. Do you remember the number?
Yes, yeah, over 700.
No, over 2,000 a month we touch.
Well, then
between
what was the 700?
Colonoscopies and in-office visits.
Okay.
It's incredible.
Okay, all right. Well, I definitely...
Thousands of patients we're talking.
Yes, so thousands of patients. So I asked her, of the patients that I do all these workups on, my nurse practitioners and myself, we work them up. I do the scoping if they need to be scoped. They get blood work. They get CT, ultrasound. I mean, whatever, because we're trying to rule out everything. In the end, the majority of these workups are negative, which is great for the patient. However, patient still comes in and they're still having bloating. They still feel constipated. They still have acid reflux. They're still not feeling well, low energy.
Which isn't technically disease, right? Like you haven't been diagnosed with anything, but it's dis-ease.
Exactly.
Right?
We
we
like
don't
that.
feel
Yes.
good,
Yes.
right? That's where disease comes from.
That's right.
Dis-ease.
That's exactly right. They feel dis-eased. Okay.
That's right.
So I asked her, these patients then that end up with you, where you work them up, you do a wellness, nutritional consult. Some of them go on to get allergy tested. A lot of them get on our supplements, our probiotics, our digestive enzymes, our greens. We have a detox. We have super salts, which are the electrolyte salts. I asked her, of these patients that you see, which you're seeing hundreds of them too, what percentage of those patients actually improve and come back feeling great?
Oh, you want me to give the percentage?
I'm done. I kind of left it up in the air, but yeah.
Well, the thing I told you is not everybody I talk to moves forward with the advice I give them.
Okay.
So I would probably say it's like 50-50.
What? Wait, 50%
50% of the people move forward with the advice I give them, and 50% of the people don't.
Okay, so let's focus on that 50%
so
that move forward.
50% that move forward with
and
the
what do
advice
those?
I give them.
And what do they do?
So it's typically supplementation, right?
Okay.
So they're adding some type of supplement to their daily regimen. They're drinking more water for sure, and then maybe moving forward with the blood spot test. You said the stuff, the workup I do. The workup I do, really, the biggest thing is the blood spot test. I mean, and not everybody gets one of those. It just depends on their issues. I would say after listening to these patients and everything they've been through, I mean, I'm not going to have more tests that they're going to go through, right? I'm just going to say, look, based on what you're telling me, this is what I think you should try, right? From a more natural standpoint. 50% of the people that move forward with those recommendations, I would say 95% of them get better. That's a very high percentage.
That's pretty significant.
It is very significant.
That is very significant.
I have some patients, and the 5%, I will tell you, very, 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 very sick patients that have a lot of other stuff going on that maybe give up on it too soon because they've tried so many things, right? Or maybe they start taking the supplement and they feel something with it. It could be like that. I'm taking something new and this is kind of freaking me out. And then they decide to stop, right? And so those are the rest of the patients, like those other 5%, but it's not many. The people who start taking this stuff and stay on the stuff, when I call them, there is noticeable difference on how they feel.
And so the key things that they're changing is, number one, drinking more water, changes in their diet.
Not really. Not at the start.
No? Okay.
Not at the start.
Okay, so drinking more water.
Unless we did the blood spot test and we had like a bunch of stuff come back showing that they were highly sensitive to certain foods, and I've asked them to stay off those foods.
Okay.
Right?
Okay.
So, but if it's not regarding the blood spot test, and it's typically enzymes, probiotics, salts, detox, greens, and drinking more water.
And those
are the main things I'm telling people, again, depending on their issues.
Right.
Sometimes I'm telling people enzymes and probiotics. Sometimes I'm telling people detox and greens. Sometimes I'm telling people probiotics and salts. Sometimes it just depends on what they're suffering from.
And that's what I was going to ask you. Like, are some of them getting on all of those?
Yes.
Or just part of them?
Some people are getting on all of them. Some people are getting on one or two of them.
Okay.
It could be different one or two depending on the issues they're having, right? So I really try to hone in on the symptoms they're having to fix the symptom first, right? Because if we can fix the symptom, then they're encouraged and they want to do more.
Right.
So then I'll get the phone call. Okay, this is gone now. I don't have my reflux anymore, or I don't have my gas and bloating anymore, or I'm having regular bowel movements every day. I want to get better. I want to get off my high blood pressure medicine. I want to get off my high cholesterol medicine. Now what? Right? So then we go deeper and we get more into food and we get more into eating cleaner and exercising and things like that.
Yeah.
To start off with, though, it's really simple. Like just adding some supplements to your regimen, drinking more water are the core things that I am saying over and over and over again.
And I just want to say, these are people, these are patients that are coming in that have had these issues for a long time.
Decades.
They've been suffering. It's affected their quality of life, the way they feel. They have no energy, and so by the mere fact that they are within a week or two, feeling better within 2 weeks.
I call everybody new that starts on this stuff. I call them at 2 weeks to see how they're doing. And 95% of the people that are taking this stuff properly are like, yes, I notice a difference. Yes, I'm feeling better.
Awesome. Yeah,
yes,
it's
exactly.
awesome.
Yeah.
It's awesome. And it's so great for them because then they're not jumping yet to another GI who's going to just repeat the same workup, okay? And just do the same test. And in the end, that patient will still be at the same place.
Yeah.
Okay. So anyways, look, we've got to bring this to an end, unfortunately, because we're running out of time. But if you want to connect with us, please go to our website, drlizcruz.com. There's a purplish, pinkish button right in the middle of the page that you can click on and you can schedule one of these wellness consults with Tina. And it's absolutely free. Okay, this is our gift to the world. This is our gift to you and to the world. And please connect with us so that we can try to help you and try to help figure out what's going on. What's
just reminded me when you said it's free. I had a patient this last week say, I can't believe you're doing these for free. You're giving a lot of really good information. I was like, oh, well, thank you. I appreciate that. Anyway.
That's awesome. Yes, a lot of great information, okay, from Tina.
Yeah. Or Jaja.
Jaja is also with us.
Holistic nutritionist.
That's right. So if you want to do this in Spanish, or if you have a family member that only speaks Spanish, Jaja is our Spanish-speaking holistic nutritionist, and she can also do the same free consultation. Okay. So connect with us. If you like this show, please rate us. Give us a 5-star rating because it's going to help other people just like you to find us. And if you haven't subscribed to this podcast, what are you waiting for? Subscribe, because that way you will not miss one episode. Okay? All right. Well, on that note, we are going to bring this to a close. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.